The prevalence of disability in Nigeria, like in many other countries, can be challenging to precisely determine due to various factors, including differences in definitions, data collection methods, and the diversity of disabilities. However, based on available data, the prevalence of disability in Nigeria is estimated to be relatively high. The 2006 census, the 2012 Nigeria General Household Survey, and the 2018 National Demographic and Health Survey all report a disability prevalence rate of approximately 2%. However, many experts suggest this is an underestimation of the actual population of persons with disabilities.
15% of the Nigerian population, of the world population, they are living with different forms of disability. And Nigeria has the highest number of persons with disability. We are 31 million in number. And if you look at this 31 million, we have what we call a kind of equity challenges in terms of inclusion.
The World Health Organization estimates that there are approximately 25 million persons with disabilities in Nigeria. This corresponds to 13.2% of the population, which would be closer to the global estimates that typically 15% of the population live with disabilities. It is further estimated that nearly 40% of the people with disabilities in Nigeria have multiple impairments, and approximately 9 out of 10 people with disabilities in Nigeria live below poverty line.
You can't separate disability with poverty, because most of those of us that have visual impairment are from poor homes. Had it been our parents were well-to-do, maybe we would have gone to better hospitals for better treatment and we wouldn't have been blind.
Persons with disabilities constitute a significant and diverse segment of society. However, they often encounter various forms of discrimination, exclusion, and limited access to essential services, education, employment, and public spaces. To this end, CSOs in Nigeria have carried out comprehensive advocacy campaigns focused on addressing the challenges faced by PWDs and promoting their full inclusion in all aspects of society. Some key areas of advocacy targeted at the inclusion of PWDs include accessibility, social protection and welfare, political participation, and social inclusion.
A lot of times we see accessibility from the point of ramp. There is more to accessibility than ramp.
The journey of the Disability Act in Nigeria is a testament to the advocacy and collective efforts of various stakeholders in promoting the rights and inclusion of persons with disabilities. For many years, persons with disabilities in Nigeria faced discrimination, lack of access to basic services, and limited opportunities for education and employment.
We conducted research about a year ago, right, to understand what kind of challenges that people with disability face in the workplace. And it was bad. Many of them see the union members, but they feel like they don't get the same treatment like somebody who doesn't have a disability.
Civil society organizations, CSOs, disability rights advocates, and persons with disabilities themselves began to raise awareness about the challenges they faced and the need for legal protections. International frameworks such as the United Nations Convention on the Rights of Persons with Disabilities provided guidance and impetus for legislative action.
The billion-plus persons with disabilities around the world are an integral part of every society on the planet. Virtually everything we do in development has the potential to affect their lives.
Disability rights advocates and CSOs started to mobilize and advocate for the passage of a comprehensive disability rights law.
Pursuant of our mandate of holding stakeholders to account for the implementation of the Act, CCD early this year organized a one-year anniversary to commemorate the passage of the Disability Act. One of the key demands we made during the anniversary was the need to establish the National Commission for Persons with Disabilities.
They organized protests and public awareness campaigns and engaged with lawmakers to highlight the need for legal protections against discrimination.
We will do everything possible within the stipulated time you have given to ensure that Mr. President has a copy of this bill.
Efforts to draft a disability rights bill began with input from disability advocates and experts. The bill was introduced in the Nigerian legislature in the year 2000, and it underwent a series of revisions to ensure its alignment with international standards and the specific needs of Nigerians with disabilities.
The urgent need for specific recognition of persons with disabilities in poverty alleviation programs.
We have come together with a coalition of other civil society organizations to come and say what is happening with our disability bill. There is no reason why after so many years in this country, Nigeria does not have a law that protects its citizens with disabilities.
We've also commenced the amendment of the National Building Code to make it in synchronym with the provisions of the Disability Act so that it's easy for persons with disability to access public buildings.
The bill faced debates and challenges in the legislative process as some lawmakers raised concerns about implementation and resource allocation, but CSOs and interest groups continue to engage in dialogues and negotiations to address these concerns and build consensus. After 18 years of deliberations, revisions, and engagement with the federal government and the National Assembly, the Disability Act was passed by the Nigerian legislature and transmitted to the President for assent in December 2018. On January 17, 2019, President Muhammadu Buhari signed the act into law, officially making it the Discrimination Against Persons with Disabilities Prohibition Act 2018.
Nigeria is a signatory and a state party to the United Nations Convention on the Rights of Persons with Disabilities, which seeks to promote the inclusion of persons with special needs in all development efforts globally. Under my leadership, government shall continue to give effect to all global, regional, and sub-regional treaties that seek to improve the lives of our disadvantaged citizens.
The focus has shifted to the implementation of the Act, as government agencies, CSOs, and disability rights advocates are working to ensure its effective enforcement. A National Commission for Persons with Disabilities was established to oversee implementation and monitor progress. Disability rights advocates and CSOs continue their work to raise awareness, monitor implementation, and advocate for the full realization of the rights and inclusion of persons with disabilities in Nigeria, as they continue to sustain collaborations with international organizations, government agencies, and other stakeholders to strengthen the advocacy efforts. The journey of the Disability Act in Nigeria reflects the resilience and determination of CSOs in striving to create a more inclusive society for persons with disabilities. While the Act represents a significant milestone, the ongoing work of advocates and stakeholders remain essential to ensure that its provisions are effectively implemented and the rights of persons with disabilities are upheld. Another multifaceted initiative led by CSOs on disabilities is advocacy for the rights, dignity, and equal participation of women with disabilities. The WHO estimates that more women have a disability globally than men, that is, 19.2% of women compared to 12% of men, due to a combination of exclusion from education and health care, poor nutrition, and violence against women and girls. Leonard Cheshire, an international organization that focuses on disability issues and works to improve the lives of people with disabilities around the world, reports that in Nigeria, persons with disabilities are underrepresented in the labor market, with women with disabilities frequently experiencing the combined disadvantages associated with gender as well as disability. Leonard Cheshire in 2018 estimates the unemployment rate of persons with disabilities, that is 15 to 24 years, to be 77%. compared to 49% amongst persons without disabilities. Moreover, those who are in work face further obstacles to progression. Only 0.9% of managerial positions are filled by people with disabilities. Of these, 100% were men. According to Leonard Cheshire, persons with disabilities also have lower access to financial services, a main obstacle to entrepreneurship. Only 12% of persons with disabilities are estimated to have a bank account, compared to 16% of persons without disability. And while 19% of men with disabilities have access to banking, the proportion of women with disabilities having a bank account stands at a mere 4%. Advocacy for Women with Disabilities Initiative, which was co-founded in 2008, advocates for the rights of women and girls with disabilities, for their inclusion in all national policies, programs and activities. AWWDI, a national program with over 50 community self-help groups across the country, focuses on activities that lead to the advancement of women and girls with disabilities and other marginalized groups. In September 2023, AWWDI, in collaboration with the Ekiti State Government, appointed the Ekiti State Commissioner for Health, Dr. Filane Oyebaji, as an ambassador for women with disabilities on sexual and reproductive health rights. This significant advocacy strategy aims to promote and address one of the unique challenges and experiences of women with disabilities.
Our main purpose is to create an enabling environment for women with disability in Nigeria. And we operated using a self-help group model where it's structured, because we know that we cannot be everywhere. So we structure using a self-help group model, creating self-help groups within states and communities. So mostly our job is community-based. We work within a community, rural area, and then far to reach communities to ensure that women and girls with disability living within those areas are reached, and then intervention is being given to them.
It is worth noting that CSOs in Nigeria have made significant contributions to advancing the rights and inclusion of persons with disabilities. Their work is ongoing, and they continue to play a vital role in ensuring that the rights of persons with disabilities are upheld in the country.